everyone. Today we will be discussing about performing a therapeutic plasma exchange procedure using a selective device, a secondary device which is attached to the normal therapeutic procedures. This apheresis technique selectively removes only antibodies which are directed towards a specific antigen. So at first the plasma is separated from the whole blood by centrifugation and then it is processed through an adsorption column. So this adsorption column contains a specific ligand for the substance which is our target and which is to be removed, and then the depleted plasma is reinfused into the patient. So hence there is no need of any replacement fluids while using these columns. So we have some certain selective, semi-selective, even non-selective columns. The most commonly used in our country, in our center is the ABO selective column, wherein everyone must be aware that glycosorb, vitrosorb, adzopac, there are certain specific ABO columns which are available. So such specific columns are also available for, LDL cholesterols like LDL lipopac, and they're also used for the lipoproteins. They're used for cholesterols, IgE antibodies, and CRP antibodies. There are certain semi-selective columns available like the immunozorba or the therazorb and IgG adzopac, which target the sheep anti-human IgG. I mean, that is the binding material. And there are many other non-selective and extracorporeal devices which are used in the market. But restricting our current episode to only the selective ABO columns which are used for the ABO incompatible transplants. So I have Dr. Soumya who's along with me, and she will be describing and taking you step by step as to how we perform these procedures, these plasma exchange procedures using a selective column, and what are the results. So when you see about the results, you have to keep a comparison between a procedural titer and a post procedural titer, and then you can have a comparison. We have done many studies on these as well, and I'll be linking the links of these studies in the comment section below for a easy reference. Thank you.
A very good morning everyone. I am Dr. Soumya. I will be demonstrating therapeutic plasma exchange using a secondary plasma device. So first, coming to mechanism of action. So the main advantage of using a secondary plasma device is that it eliminates all the blood group barriers for ABO incompatible transplantation. So this table shows that according to donor and recipient blood group, appropriate immunoadsorption column is to be used. So for example, if the donor blood group is A and the recipient is O or B, then immunoadsorption A column is to be used to adsorb anti-A antibodies. If the donor blood group is B and recipient blood group is O or A, ABO B column is to be used to adsorb anti-B antibodies. If the donor blood group is AB and recipient blood group is A, then immunoadsorption B column is to be used to adsorb anti-B antibodies. If the donor blood group is AB and the recipient is B, then immunoadsorption A column is to be used to adsorb anti-A antibodies. If the donor blood group is AB and recipient blood group is O, then ABO AB column is to be used to adsorb anti-A and anti-B antibodies. Coming to the requirements which are needed to perform a secondary plasma device using a vitrosorb column. Coming to the requirements, first is a 1000 ml NS, 500 ml NS, 250 ml NS for loading calcium, one transfer bag, sterile dressing set, sterile and unsterile gloves pairs, gauze packets. The vitrosorb column which we are going to use today is the ABO-A column because patient is O group and donor is A group. Check for lot number and expiry date and check whether the column is tightly sealed from external. Next, we are going to take the 25,000 units of heparin, which is used for priming the device. Next is the 50 cc short tip syringes, 16 gauge needle, 10 cc loading syringes, and calcium gluconate is to be taken according to patient body weight and diluted in 100 or 250 ml NS and given throughout the procedure. I am going to demonstrate the procedure with the help of spectra-optia apheresis system, and the kit used is the orange colored kit. Check for expiry dates, lot number, and reference code for this kit is 10220. After turning on the machine, select the procedure named as secondary plasma device and then touch confirm. The filler required to perform secondary plasma device is the standard filler, and the kit used is the orange colored kit with a reference code of 10220. Detailed demonstration of this kit loading is described in our previous episode on how to perform therapeutic plasma exchange. You can also refer to it. So the first procedure is to remove all the coils and place into the respective positions. So now we are taking the plasma bag and hanging into the IV port. Next we have hanged the bent bag in the IV pole stand, and then the inlet line which has red color roller clamp and return line which has blue color roller clamp is being hanged into the hanger. Next we are going to place the cassette on the sensory board. Before placing, ensure there are no distractions and no disturbances, and gently place the cassette on the sensory board. After fixation, you will get a click sound. Then open the centrifuge. Centrifuge loop is to be fixed along with the channel, and it should be fixed into the 3 sides as shown. Then rotate the centrifuge and check if there is any bend or twist in the centrifuge belt and loops, and then close the centrifuge door. We have performed all the 4 steps now. First, remove coils and bags, place the cassette, insert the channel, and then we have closed the door. Now we are going to load the kit. Press load. Now the cassette is getting lowered. Always check for any obstructions before loading the cassette. The next step is to clamp the extra remove line. Close the red and blue roller clamps. So first we are going to clamp the extra remove line, which is in yellow color. So we have clamped. Next we are going to close the red and blue roller clamps. And then press continue. So the now tubing set is being tested. Next is to clamp the red and blue return and inlet lines. So we are clamping the red and blue return lines now. Press continue. Next step is to prime the kit with the help of AC and saline. So the steps are: spike the AC, squeeze the drip chamber and place line in detector. So for that we have taken ACD and 500 ml normal saline. So first we are going to spike the ACD line. So orange color tube is to be spiked with the ACD and hang in the IV port. Squeeze the drip chamber and place the AC line, that is the orange line, in the AC line detector. Next, spike the saline line with the green line. So we have taken 500 ml NS, gently spike the saline with the green line and hang in the IV pole. Squeeze the drip chamber. Only the AC line has detector. The saline line don't have a detector. So next, start prime. First AC line will be getting primed. Next, to prime the return lines, open the inlet and return saline lines. So red and blue roller clamps are to be opened and press continue. So first AC line is primed. Now the return line is getting primed now. We can see the drip chamber of the saline line is getting filled and it is entering into the cassette and into the tubing sets. So after return line, inlet and RBC lines will be primed and then the centrifuge channel also will be primed. So next, we have to enter the patient data, whether the patient is male or female, patient height, weight and the recent hematocrit value, and touch confirm. Next, we are going to set the plasma device setting values. First is the prime divert volume. We are going to keep 100 ml. Replace pump balance. We have kept 100%. This can also be changed in the future. Next, maximum plasma flow rate. It can be set up to 70 ml per minute. So we are setting it to 70 ml. Saline prime. Yes, we are going to do with saline prime. And then touch confirm. Next, coming to run values, the inlet AC ratio is kept 12. Today we are going to process 4 plasma volume. So it is set to 4. So for 4 plasma volume, the total plasma treated is 13421 ml and the time taken is 499 minutes. This is the inlet speed and this is the plasma speed ml per minute. And then touch confirm. Next is clear saline from the drip chamber and then again rehang the and then touch confirm. So next step is to connect extension tubing set to extra remove line, unclamp the extra remove line and prime line and extension tubing set, clamp the remove line and connect extension tubing set to inlet end of plasma device. So next we are going to proceed with all the 4 steps now. Open the vitroscope column. While opening the column, check whether the same column is present inside the box also. So we are going to use now Secorum ABO A column. So it is correct. And also check again for the expiry and lot numbers. Now we have confirmed that there are no external damages. So gently open the column. So this column volume is around 70 ml with a net weight of 230 grams. It has 2 connectors, male and female lock connectors. So we have clamped both the lock connectors and gently open the device. So the adsorption matrix made here is polymethaacrylate and the tubing set is made up of PVC. And the active component here is oligosaccharide and it should be stored at a temperature of 5 to 25 degrees Celsius with a shelf life of 1 year. So next we are going to perform the 4 steps mentioned above. We are not going to use extra extension tubing set to connect to the vitroscope device. So first step we are not going to do. The second step, unclamp the extra remove line and prime the line. So we have unclamped and primed the extra remove line. The third step is clamp remove line. So we have to take the remove bag, clamp the line with the help of the sealer. So we have clamped the extra remove line and disconnected it. To the next step, connect extension tubing set to inlet end of plasma device. So we have not used the extension tubing set. We have now just going to connect to the extra remove line with the inlet end of plasma device. So open the extra remove line and connect to the inlet end of plasma device and unclamp the lines. So we are now going to unclamp the yellow line. The next step is to connect the outlet end of plasma device to the waste bag. So for this we have taken IV set. One end of IV set is connected to the outlet end of the plasma device and the other end is spiked to the waste bag. So this waste bag will contain the primed fluid. So with the help of IV set, we have connected the outlet end of plasma device to the waste bag and then touch confirm. Unclamp the lines. Next is to prime the device. So for priming the device, 25,000 international units of heparin 5 ml is taken, out of which 1000 units, that is 2 ml, is to be added into 1000 ml NS for priming the device. So now we are going to take 2 ml of heparin and add into 1000 ml of NS and mix it. So mix it gently. This 1000 ml NS, it should be clamped into the replacement line and the priming is to be started. Now the priming has started. The flow rate we can start from 30 ml per minute and it can be increased to 50 or 60. So from the inlet end of the device, saline enters and it comes out through the waste bag. So now the priming has been completed. Next step is to clamp the replacement line. Spike the second replacement line into the treated plasma bag. So next step is to clamp the replacement line which was used for priming. Second step is to spike the second replacement line with the transfer bag. So this is the second replacement line we have connected into the transfer bag and unclamp the line. So this is the transfer bag, that is the second replacement line where the treated plasma will be getting collected. And touch continue. Next step is to prime the inlet and return lines. So for that, unclamp the red and blue lines and let the fluid out and close the clamps. Next, unclamp the red and blue roller clamps and touch confirm. Next step is to connect it to the patient lines. So before connecting to the patient, we have to flush the lines of the HD catheter and check for adequate flow. So now we have flushed the line and looking for the flow. In our patient, both red and blue, the flow is good. And then connect the red and blue lines, that is inlet and the return lines, to the HD catheter lines. And unclamp the 2 red clamps and 2 blue clamps. And touch continue. So first the interface will start establishing. Meanwhile, connect the calcium gluconate to the peripheral line of the patient. So now the fluid will start diverting from the plasma device. After around 100 ml of fluid, the next step is to confirm that the treated plasma bag does not contain fluid, and now we have to connect the treated plasma bag with the outlet end of the device. So for that we are unclamping the IV side from the waste bag and clamp into the treated plasma bag and open the clamps. So now we have connected the outlet end of the plasma device into the treated plasma bag. So and then touch confirm. So now the plasma bag, that is the treated bag, will start filling plasma. Slowly the whole blood enters into the cassette. Plasma is separated and enters into the inlet end of the plasma device. And inside the column, anti-A antibodies are getting absorbed and the filtered plasma is coming out of the plasma device and it is going into the treated plasma bag, that is the transfer bag, and it will be given to the patient as a replacement fluid. So it will be given to the patient. So this replace pump balance we have set to 95% so that there is adequate amount of plasma in the treated plasma bag. This can also be changed. Once appropriate amount of treated plasma gets filled in the transfer bag, the treated plasma goes as a replacement fluid to the patient and the screen will show treating plasma. So here we can see the treated plasma is going as a replacement fluid to the patient. So this is the end of the procedure. We have processed 4 plasma volumes. Before rinsing back the patient, plasma device is to be rinsed back. That is the next step. So around 50 ml of volume is to be rinsed back with the plasma device. After the rinsing back the plasma device, the rinse back of the patient will be started. So now the rinse back of the patient is started and the remaining blood components are given back to the patient. After rinse back, close the inlet saline line and inlet return lines and then disconnect the patient. So clamp the blue lines and clamp both the red lines and disconnect the inlet and return lines from the patient HD catheter. After disconnecting, flush the HD catheter with heparin and close the tube and do a sterile dressing. After disconnecting, we have to unload the kit. After unloading, the summary of our procedure will appear on the screen. So here we can see the total plasma volume treated was 4 PV and the plasma treated is around 13865 ml. ACD used to the patient is 1689 ml and the inlet processed. For reuse and storage of plasma device, at the end of the procedure, the plasma device is to be rinsed back with 1 liter of heparinized normal saline and stored at a temperature of 5 to 25 degrees Celsius, and this device can be used in the future for shelf life of 1 year. Thank you for your patient listening. I hope the demonstration of Vitrosop column helped you. If you have any queries, kindly ping us in the comment box and stay tuned to this channel for more videos. Thank you.